Hello, my name is James Geiger. I'm a medical doctor, board-certified anesthesiologist. I've been doing anesthesia for 35 years, which takes my breath away in many ways. And I'm a clinically certified aromatherapist. Tonight I'm here to talk to you about how both of these fields are related. When you think about anesthesia, I realize that it's usually three different things. It's usually intravenous and gas and sometimes topical or injectable into the skin, or where we do blocks around nerves, where the surgeon does local anesthetic to block the skin. I've done lots and lots of very specific nerve blocks and spinals and epidurals and general endotracheal anesthetics and sedation anesthetics, monitored and conscious and unconscious sedation techniques. And they're all numerous and varied. They can be mixed in many, many different ways. But the thing that really reminds me of its great application in the realm of aromatherapy is that when you're breathing anesthesia gas, you get very known effects from it. When you're breathing essential oils, aromatherapy vapors, you get very known effects from that as well. So I'd like to start out with mentioning several books. This is the second edition of Robert Tisserand and Rodney Young's book on essential oils safety. If you ever have any questions about oils yourself, this one's really remarkable, not just in its size and weight and cost, but in the fact that each system of the body and the most current references are all discussed. Each plant's oils as a whole are discussed, and many of the chemicals individually from the plants are discussed in this. So you can look things up from various standpoints. You can look up the genitourinary system. You can look up juniper. You can look up cinnalol. These oils have great applications in the clinic realm. Jane Buckle, this is her one of her latest editions of her clinical aromatherapy book. My research is mentioned in it on using ginger in anesthesia, because I thought it was a great idea that she gave me to use ginger on my anesthesia patients so that they wouldn't be nauseated afterwards. It's turned out to be very, very effective. I wrote an article on it that was published some years ago, and then it was followed up with a real randomized, controlled trial using ginger and peppermint and spearmint and cardamom, each differently on gauze for postoperative nausea treatment in the recovery room. I like to think of ginger being used as a prophylaxis to prevent it, and starting early in the plan, just like with enhanced recovery after surgery and anesthesia. Protocols are now being used where many things are done in the preoperative phase to make the postoperative phase more effective, get better results, better outcomes. So her book is really remarkable in that it divides chapters out by all the different businesses in medicine: psychology, ICU, cardiac, pulmonary, GI, all the different specialties. And this one, Aromatherapy for Health Professionals, likewise, very, very strong clinical approach to the use of essential oils. So that's just by way of introduction to some books that I like. But what I'd really like to do is do a journal club with you right now and just share with you some of the titles. I'll read them quickly and give a little outline of them, so that if you need to go back and look them up, you'll be able to go back on the video itself and track down the name of the article. This one's Essential Oils, Extraction Techniques, Pharmaceuticals, and Therapeutic Potential, a review from Current Drug Metabolism 2018. So this one is very interesting as a review. It's reviewed and written by authors from different countries in the world: South Africa, Turkey, Malaysia, Saudi Arabia, Australia, to name a few. And they go over many of the basics of essential oils in terms of their general introduction and the chemistry, the different types of chemicals, the monoterpenes, sesquiterpenes, diterpenes, alcohols, ketones, and then they go into the methods of extraction. Most of these oils are steam distilled, some are cold pressed. There are fancier techniques using hexane to extract them, and they go into some of these different methodologies and show some pretty cool pictures. We prefer, or at least I prefer, the steam distilled ones rather than solvent extracts, because the solvents in supercritical fluid extraction are more expensive and could leave residue in the mixture. One of the things that this article does that I think is really good is it reviews the therapeutic potential of essential oils by quoting many different plants from all over the world and how they have been applied in cancer, prostatic cancer, breast cancer, and lung cancer in particular. So you can use this article to try and track down what's the latest research on which oils have been found to be effective on different cancer cell lines. No human clinical trials are being done on these, but that's when I'm talking to you, and it's not necessarily how oils are used, but also how I would like to see oils used in the future. Many things in medicine, they all say, and more studies are suggested as their closing phrase after their conclusion. And that's what I feel about many of these essential oils articles, the reviews, where they're saying more studies need to be done. And I say more studies need to be done, not necessarily in the laboratory, but in specific clinical applications. But not so much so that you end up having to wait around for RCT studies and IRB studies to be accomplished before you actually get to actually having the patients benefit from the oils now today, because there's a stack of great literature which supports the use of essential oils on humans now. But more should be studied and more should be known about how these can be delivered. There's a section in here on essential oils as skin penetration enhancers for transdermal drug delivery. There are known medications which are absorbed more quickly through the skin and more efficaciously in their benefits when they are combined with essential oils, when they are used topically. Another section in here talks about oils as antiviral agents. I'll get that into more detail with another article, but here they actually mention Mexican oregano being very powerful, rich in thymol as an antiviral agent, and then the 8 species of eucalyptus oils, we'll get into those in more detail as well, where they substantially recognize them as having antiviral potential. As far as a review article, I rate this one as a very good general article for starting off. What I did when I first started off, and Jane advised me to use ginger, I wrote the essential oil of ginger, Zingiber officinale and anesthesia, where I actually took 100 of my patients and split them into groups. I took the highest risk patients that I could figure would probably be nauseated no matter what I did with the intravenous stuff, medications to prevent it, in the recovery room, and then I used ginger on them and found that it really worked in a significant way, capturing another percentage of them from that pack that would have been normally sick to their stomach afterwards. And I used a very strong endpoint. The nurses in the recovery room, they usually ask as soon as their eyes open and they can talk, are you nauseated? And if they would say no, that to me, that was a ginger success. So you have to have a great endpoint when you're doing these studies, and methodology really, really matters when you're actually doing a real study. And many of these methodologies in some of the older literature, especially in the last century, they were not reproducible because they didn't really define how they obtained the oil so that I could get the same oil to use again if I wanted, because different oils, different times, different batches, different places, different manufacturers, different techniques, different growing sites, so many variables influence the way that the oils actually are have the ability to cause a positive effect in the body. Here's an article, Essential Oils and Functional Herbs for Healthy Aging. As I age, I've become very concerned about my brain and brain power and preserving it. And I look at oils and essential oils as supplements, as prophylaxis against the deleterious effects of aging. Not using the brain enough is one way to wear it down. Another thing is to not feed it well. Another is to contaminate it, or not to be aware of your needs for supplements. There's a lot of literature now which is saying that supplements are a waste of money. Well, they're not really specifying which supplements they're testing when they're saying that. Some of them say the antioxidant effects are not good enough for athletes to decrease their problems after working out. But one of the things that's great about oils is that they have one of the highest antioxidant capacity of any substance supplement-wise, and they didn't test them. But this article starts off talking about Alzheimer's disease and aging. You know, there are several different medications which have been prescribed for aging patients to improve memory or to keep it from disintegrating so rapidly. And I'll get into that when I talk about the anesthesia article that I wrote that's been published recently in that regard. But there are many different herbs which are used. Ginkgo is one, and there are others which can be thought to be helpful. The medications can be thought to be helpful, but by the time you have advanced dementia, they say that you really shouldn't be on these memory-enhancing drugs because of their side effects. There are risk factors for dementia besides just the fact that you might have a genetic predisposition to it. Type 2 diabetes, non-insulin diabetes, is a risk factor for this fibril problem where the fibers get all tangled up and cut short. As far as screening, what they did was they were screening the therapeutic benefit and beneficial activities of the oils and herbs, and they came across a list that they thought would be worth studying. Lavender, peppermint, sage, lemon myrtle, oregano, rosemary, and they were investigated in this article. And they did a short summary of what their findings were, and a lot of their findings were based on how they inhibited alpha amylase, which is one of those diabetes food chain issues in your bloodstream, alpha amylase, as well as the acetylcholinesterase inhibition properties of those oils, and found them, along with a Mediterranean diet, to be worthwhile to pursue. Another good one that I came across: neuroprotective and anti-aging potentials of essential oils from aromatic and medicinal plants. This one was a Pakistani article from the Frontiers in Aging Neuroscience, May of 2017. And it summarizes a lot of the deep brain physiology and depositions that go on. And again, reiterates the idea that oils can be used to increase acetylcholine, which is that memory molecule that helps fire those synapses in the brain for neurotransmission. And I think that their pictures are quite fabulous. There are color pictures in here where they actually itemize some of the problems with the neurodegeneration, the neurofibrils, and the depositions of accumulation of beta amyloids. Definitely an article worth pursuing. So here's the article that I wrote. It was published in the International Journal of Anesthetics and Anesthesiology, 2018. And the title that I chose for it was Anesthesia Implications of the Use of Essential Oils in Alzheimer's Dementia. I came across a British Medical Journal case report where they talked about this medication donepezil, which is one of the medications that's prescribed for memory loss patients to help boost their acetylcholine levels and their memory synapses by blocking acetylcholinesterase, the enzyme that breaks it down. So if you block the enzyme that would break it down, you would obviously have buildup of the acetylcholine. But what they found was that people who did not stop donepezil beforehand had difficulty with their anesthetics in one particular regard. We use neuromuscular blockers, short-acting and long-acting in different circumstances in anesthesia for different surgical presentations, starting with the airway and then perhaps abdominal surgery or muscle relaxation required. Short ones are usually used, short neuromuscular blocking agents, paralytics, are used at the beginning often for difficult tracheal intubation. But what they found was that old people on donepezil, that the succinylcholine, instead of being degraded by acetylcholinesterase in the typical 2 to 5 minute range, it lasted a long time. Some as long as if they had had a genetic predisposition to not being able to metabolize succinylcholine, this one medication. So it really was a red flag to me that this could be a significant problem, and that if I hadn't heard about it before I read this case report, probably many others didn't, and that's what caused me to be excited about writing this article and looking at all the different oils. One of the key things that they found about all the different plant oils was that the whole oil was better than the actual constituents that are in them. When they tried to isolate what constituent is in the lemon oil or in the lavender oil that makes the acetylcholine levels rise by blocking acetylcholinesterase, if they thought it was the linalool and they tried that, it didn't do it nearly as much as if they used the whole oil. So the whole oil seems to have a much better effect, and therefore a much more likely possibility of being a supplement that could be prophylactic and help with memory than using just the constituents, which is how the pharmaceutical industry works. You know, with our current narcotic problem globally, you know, pharmaceutical companies have now developed an end-to-end way of dealing with pain, develop all these different narcotic-related pills and intravenous agents to control pain, and pain needs to be controlled. And then people start to get out of control using these medications for pain. So the other end of the treatment is the reversal agents to save people from dying from an overdose, all the different Narcan-related products. So they have an end-to-end industry, but what we need is an end-to-end solution so that we don't end up with Alzheimer's dementia. And that's why studies need to be done with oils to help determine specifically which oils would be good prophylactically and as a treatment for Alzheimer's dementia. There are many different forms of dementias. Some of them are not that treatable. Some can be vascular, frontotemporal. So there are different types of dementias, and there are new blood tests which are now available for analyzing your gene type and your ApoA concentrations and things like that, so that you can have a better idea of where you stand as you age and what your needs might actually be. This article on eucalyptus, biological, medicinal, toxicological significance of eucalyptus leaf essential oil, a review. This is published in the Journal of SCI, July 2017. They go over a lot of the background and the history of it because eucalyptus globally is a massive industry in and of itself. There are so many different species of it and so many different oils that come from these species. I mean, you can have different eucalyptus which doesn't even smell like eucalyptus. It can smell like lavender or lemon, not the typical eucalyptus that you would recognize growing, say, in the Napa Valley or in Golden Gate Park in San Francisco. But some of the areas that it specifically covers, and I'll just list the topic headings, which are fascinating as far as a review article. Anti-diabetic, in other words, to decrease glucose in the bloodstream. Anti-hymenthic, antiviral, antihistaminic, anti-inflammatory. Skip a couple of pages. Antimalarial, antioxidant, cytotoxic, larvicidal, nerve blocker, painkiller, respiratory diseases, wound healing. So I'll mention the respiratory one because that's where most people think about eucalyptus. They probably encountered it in some Norwegian spa, perhaps, where they were, waving the oil and the smell around for the scent in the spa. But one thing that eucalyptus oil is rich in is 1,8-cinolol, eucalyptol. And that is known as an expectorant. It's been known in the literature, folk literature, for many years to help expectorate. And that's why some people do a steam tent. That's what my father used to have me do when I get bronchitis as a kid, a steam tent. But in those days we didn't have the oils, so he would put in the Vicks or whatever, and that may have been what some people's very first aromatherapy treatment was, Vicks Vapor Rub. It was mine. And then what does it have in it? A few percent of eucalyptol and thymol, a couple other chemical constituents, not the whole oil, but the chemical constituents in particular. There have been some studies where they put asthmatics on 1,8-cinolol 300 milligram tablets or capsules and found that they had improvement in their asthmatic symptoms. They breathed better, they had less work of breathing, they answered their subjective questionnaires in a more positive way about how these 1,8-cinolol capsules using the chemical constituent of eucalyptus helped them breathe better. It also decreased the amount of steroids that they needed, steroid inhalers and their oral dose. And it was measurable and significant. There are a couple studies along that line. So there are miscellaneous uses that they list here, and a long list of references. Great article. So I mentioned copaiba. This article is fascinating, from Current Pharmaceutical Design 2016, Polypharmacological Properties and Therapeutic Potential of Beta-caryophyllene, a dietary phytocannabinoid of pharmaceutical promise. This one originates from the UAE and that university. It's a fabulous review article on beta-caryophyllene, which is in several other oils as well, not just copaiba, but it's in ylang-ylang, white pepper, black pepper, clove, rosemary, basil, oregano, ravensara, lavender, and helichrysum as well. Different concentrations from different plants of that. The copaiba oil, the reason they call it a phytocannabinoid is because it works on cannabinoid receptor 1, not CBD2, but only 1, which makes it a different class as far as an essential oil supplement, because it's not psychoactive at all, and yet it works on nerve endings remarkably. I've seen numerous testimonies where this beta-caryophyllene rich copaiba oil was extremely beneficial to people who end up with the side effects, basically the complications and ramifications of diabetes, where their feet are painful, diabetic neuropathy. And that's just one example in this long, well-done review article covering basically a whole review of systems of the body. Alzheimer's disease, depression, cerebral ischemia, diabetes, ulcerative colitis, myocardial infarction, liver fibrosis, dyslipoproteinemias, just a long list of different physical diseases, but by disease, respiratory system, renal system, cardiac system, all working on CBD1 receptor through this beta-caryophyllene, which is a fabulous molecule. This article, Protective Essential Oil Attenuates Influenza Virus Infection, an in vitro study in MDCK cells, published in 2010, BMC, Complementary and Alternative Medicine. What's very remarkable about this article is that it actually gets into the molecular genetics of oils and virus. And that's what really caught my attention. I got a master's in biology with an emphasis in molecular genetics many years ago. And I was wondering what I would ever do with it when I went into medicine. And There were a couple little tidbits here and there, but nothing stood out until I found the essential oils and found this comment where it says, in the conclusion, an essential oil blend significantly attenuates influenza virus PR8 infectivity in vitro without affecting viral binding or cellular internalization in MDCK cells. Those are a type of canine kidney cells, so it's not really a human study, but it is a viral study of a virus which is like H1N1. We've had a lot of different really nasty viruses in this century going around. And the rest of the conclusion reads, oil-treated virus continued to express viral messenger RNA, but had minimal expression of viral proteins, suggesting that the antiviral activity may be due to inhibition of viral protein translation. If a virus infects one cell, it is designed to make that cell to take over its genetic component to make many, many, many viruses, and so you end up with viremia. Virus in your bloodstream, because one becomes billions. That is a problem that apparently can be blocked by the use of essential oils, because it keeps the virus from making translating the information on the messenger RNA for translation of viral protein synthesis. So it can tell the cell, take over, but it can't take it over because the oil is blocking that phase of viral growth. I think that's just an absolutely fabulous concept. There are other oils which are powerful and are discussed in this article, essential oils as complementary and alternative medicines for treatment of influenza. And this is from 2016, the American Journal of Essential Oils and Natural Products. So they start out by saying, what is flu, and mention all these different types of bird flu, swine flu, Hong Kong flu, Asian flu. And then they start reviewing the literature on specific oils: bergamot, cinnamon, eucalyptus, geranium, lavender, lemon balm, lemongrass, tea tree, thyme. And then two plants that I'm not familiar with, baequine root oil and yungingko root oil. And what they found was that all of these oils, when tested on virus, worked really, really well at very low percentages in vitro. Not in a human, not in vivo, but in the glass, in vidrio, in the glass dish, and the solutions that they do these tests in. 0.3% was an effective concentration of these oils against various forms of viruses. Then they went on to talk about essential oils components, the constituents of oils, where they're actually mentioning how cinnamon aldehyde worked on H1N1, and the germachrome, and the beta-santalol from sandalwood. And they also found that very low concentrations of these single constituents from whole plant oils were very effective in working as antivirals. So in this winter season, I think it's wise for us to be aware that oils can be effective as antivirals for boosting the immune system. I've seen other studies where the ratios of certain CD cells and TB cells and killer cells, those ratios were enhanced under clinical conditions and with the use of various oils. So when I saw these terms, boosting the immune system previously, I was looking for the science behind, how can you just say boosting the immune system? I need the science. So I found many of these articles, and it's too much information to try and relate all at this moment in this video.